The time is 19 minutes to 8. This is Conversations on Energy FM 102.1 and Choice FM 101.1. Our resident gynecologist, Dr. Maluleke, joins me in studio now, and it is consultation time as always. Start sending through all of your gynecology-related questions. This is how you can get in touch with us. Our WhatsApp text line is 079295121. 07929511212, and you can also send us a voice note to 060-771-5107, 060-771-5107, or you can give us a call. The number to dial is 015-151-1058, 015-151-1058.
Call us now on 015-151-1058.
Dr. Maluleke, good evening. Welcome.
Evening, Rebecca. Good evening to our listeners.
How are you?
Well, and you?
I'm well, thank you.
Great.
We'll immediately get into the questions because people have already started sending their questions. Good evening, Rebecca and Doctor. I'm a 55-year-old woman. My bladder always feels full, but when I go to the ladies only, a few drops come out, but immediately after that I'll still feel that I have a lot of urine and it has that burning sensation. I've consulted some time back and was given a powder to drink and water, but it's not going away. It stops for a while and then it comes back again.
Well, the likelihood is that the listener is having a prolapsed bladder, what we call a cystocele. A cystocele is a result of the laxity of the pelvic floor muscles following childbirth, right? And it does not matter how many babies you've had, but the higher the number, the more the likelihood that you'll suffer from this. It will be exacerbated by the menopausal state. She's 55 now, she's at the menopause. With menopause, there is estrogen deficiency. Therefore, there's thinning of the muscles in the pelvic area, including muscles that normally support the bladder. So typically you would have an urge to go and pass urine. Once you have passed urine, you always have a feeling of incomplete voiding, incomplete emptying of that bladder. And it's because some urine is now you could say captured in that area which is lax and cannot come out. This is someone who may benefit from an operation that lifts up that bladder so that things go back to normal, which is known as an anterior repair or a colporrhaphy, or sometimes what they call a sling. They go and put a sling to push the bladder back into position.
And when you say it does not really factor much how many children one has had, even if one has had one child.
Even if you have had one child, you can still suffer from destruction of the pelvic floor muscles. Childbirth is actually a major culprit in this respect. And there are a number of other factors that may be at play here. The duration of the labor. The longer the labor, the higher the likelihood that you'll suffer from this. The size of the baby. If the baby is very big, the destruction is also worse. And also whether there had been instrumentation at the time of birth. They use forceps to pull that baby out. All these things will play a role. And indeed, it does not really matter how many babies you have. But if you have had quite a number, you are the one who's likely to suffer from this compared to someone who has had one or even two.
And it mostly shows when one reaches menopause?
It might show earlier in those that are like, but the majority of people will suffer when they get to the menopause because there now the support system is not there anymore. And therefore, it's much commoner in older women.
And so if it happens in the instance where one is still during the ages in which they can conceive, does it in any way hamper their possibilities of or their chances of conceiving in any way?
No, it doesn't. It doesn't affect the conception aspect. but it may influence the mode of delivery. When you've had prolapse and maybe you had a repair, it might not be sensible for you to want to have a normal delivery. In fact, there was an article published in one of the lay magazines, and the title was Too Posh to Push. Too posh to push, meaning that there are women nowadays who decide that in order to preserve my pelvic floor muscles, I'd rather have a cesarean section than to have a normal delivery. Because if you don't have a normal delivery, the integrity of the muscles will always be maintained. And therefore, you will avoid things such as prolapse. It also, by the way, does affect sexual enjoyment. When you have prolapse, the vaginal opening tends to be quite wide, and therefore sex becomes a bit unenjoyable. So for these reasons, there are women who would say, I'd rather have a cesarean section. This is important because there is the perception that says this incidence of cesarean section is doctor-driven. Doctors are keen on doing scissors because they tend to make more money, which, by the way, is not true. But there are women who, because they read and they Google, will come and say, Doc, I have made up my mind. I would like you to take my baby out by cesarean section when the time is right. And when you engage them, they will give you reasons such as those. So it is not necessarily a doctor-driven practice. Patients, particularly in private practice, play a major role in this.
All right. Good evening, Dr. Rebecca. Earlier this week, I experienced terrible pain after intercourse. It was like labor pains. The pain lasted for about an hour. Should I be worried?
Well, it looks like this was a once-off kind of thing. It's not something that is recurrent. There could be something at the time, could have been something at the time that could explain why she had pain. But if this is recurrent, yes, it will warrant further investigation and appropriate treatment. But if it was once off, we can only speculate.
Would you say that they should be alarmed already, or?
Not if it does not recur, but if it does, then yes, she must worry. She needs to go and consult.
Okay, let's get a few more questions. Good evening. I'm a 33-year-old woman. I've lost interest in sexual intercourse. Even if I try to do it, I end up bleeding. Could I be having a problem? I think we read this.
We talked about this last week. This
Let's reiterate
question,
just in case they missed it.
Right. The issue of bleeding with sex, we would highlight that as a problem. No woman should bleed as a result of intercourse. When you do, it indicates that there is a problem on the genital area or in the genital area. And this could either be vaginal, it could be on the cervix as well. There are a number of reasons why this may happen, but we worry mainly about malignant conditions such as cancer of the cervix, mainly. And there could also be growth such as polyps, which is a protruding benign growth through the cervix, which bleeds easily. When you touch it, it bleeds. That is not dangerous though. And when we pick it up, we can even deal with it on the spot in the rooms without necessarily going to the theater or to the hospital. But cancer of the cervix is what we would like to exclude.
Hi, I want to know about the process of vagina tightening that can happen after giving birth to 3 kids or more.
This is what we were talking about earlier. If you have had 3 kids, the likelihood is that the muscles are lax and you will need what we call a colporrhaphy or a repair. Posterior repair, anterior repair. Sometimes you may find that the uterus itself is also prolapsing, and there are degrees of prolapse. The first degree is minimal. Second degree would be when the uterus or the cervix is, you can visualize it without necessarily having to part the labia. And the third degree of prolapse, the cervix would literally be outside the vagina. That is uterine prolapse, what they call procedentia. And therefore, when you go and treat a person like that, You may actually also do well by advising them to have the uterus removed, what we call a vaginal hysterectomy. It's removed from below. Because if you don't do that, you're not likely to succeed in repairing or restoring the integrity of those muscles. The uterus is already out there and may need to be repaired, may need to be removed.
Yeah, all right. This is how you can get in touch with us if you also have a question for our resident gynecologist, Dr. Maluleke. Our WhatsApp text line is 079-295-1212, 079-295-1212. Our voice note line for WhatsApp, that is 060-771-5107, 060-771-5107. You can also give us a call. The number to dial is 015-151-1058, 015-151-1058. We'll continue with this conversation after the break.
Have your say. Call us now on 015-151-1058.
Energy FM and Choice FM care with the COVID-19 alert. To prevent the spread of COVID-19, clean your hands often. Use soap and water or an alcohol-based sanitizer. Maintain a safe distance from anyone who is coughing or sneezing. Wear a mask when physical distancing is not possible. Don't touch your eyes, nose, or mouth. Cover your nose and mouth with your bent elbow or a tissue when you cough or sneeze. Stay home if you feel unwell. If you have a fever, cough, and difficulty breathing, seek medical attention. Stay tuned for more COVID-19 alerts.
The most exciting part of a wedding for a bride is wearing the perfect wedding dress. Beauty of the Bride specializes in perfect wedding dresses designed for a fairy tale wedding at affordable prices. Come check out the new Beauty of the Bride bridal boutique opening in Polokwane on Thursday, 1st of April. Get a 20% discount on all wedding dresses hired in April. Visit Shop 13, Standard Bank Square, beautyofthebride.co.za or call 072-472-5181 to book a free appointment. Beauty of the Bride. It's all about the dress.
T-Drive, the #1 safety ride-sharing app in Limpopo. Go to Play Store and download the app now. We guarantee you safety and affordability. Do you have a car? Make extra cash. Download T-Drive Drivers app now and start earning. Follow us on Instagram and Twitter at T-Drive7 or visit www.tdrive.co.za for more info.
Zanzi, we're not out of the woods yet. The coronavirus pandemic is far from over, and we need to keep protecting each other by wearing our masks properly. Even when we're around family and friends, you need to make sure it covers your mouth and nose and it fits snugly against the sides of your face and it doesn't have gaps. So continue to follow all the protocols, because together we can stop the spread of the coronavirus. The Solidarity Fund, Unity in Action. The time is 5 minutes to 8. This is Conversations on Energy FM 102.1 and Choice FM 101.1. I'm in conversation with our resident gynecologist, Dr. Maluleke. And as usual, we are taking all of your gynecology-related questions. This is how you can get in touch with us. Our WhatsApp text line is 079-295-1212, 079-295-1212. You can send a voice note to 060-771-5107, 060-771-5107, or you can give us a call.
Have your say. Call us now on 015-151-1058.
015-151-1058. That is the number to use to dial us. All right, good evening, doctor. I've been experiencing lower abdominal pains. What may be the cause of the pain? Please note I'm not on my periods.
She's experiencing pain that is not related to periods. That would be what we call chronic pelvic pain, because it's acyclical, whereas the period pain would come at certain times of a cycle. This is random. Chronic pelvic pain could be a result of a number of things, some of which might not be gynecological, by the way. Because in the pelvis or in the abdomen, you do have the reproductive structures, namely the uterus, the tubes, the ovaries. You also have the bladder. You also have the ureter. You do have muscles. You've got intestines there, structures such as the appendix, the large bowel, the small bowel, and you also do have bones. Any number of those could give one pain. We, on the other hand, as gynecologists, would pay particular attention to the reproductive structures. And sometimes people tend to blame the uterus. And I've seen quite a number of women who would have had an operation to remove the uterus for this kind of pain, and yet the pain is still there, which means the diagnosis was not correct. So before we can say this is a uterine in nature, we need to do necessary investigations to exclude other possible reasons, so that when we embark on treatment, we should direct it to the cause rather than to be in the dark and not know what's going on.
Good evening. I would like to know from the doctor that I'm having a problem of itching on the vagina. Is this an infection, and can it be treated?
Right. Itchiness could also be a result of a number of things. As far as we know, the commonest one would be an infective cause such as thrush or yeast infection, which is very, very common. But there could also be dermatological problems. There are conditions such as lichen planus, allergic reactions. You may find that the panty liners that she uses might be the reasons why she's developing this kind of problem. And therefore, unless she's examined, it might not be useful to prescribe medication which might not be helpful. For example, when the problem is due to dermatological reasons, the treatment is often steroids. Now, if you gave steroids in someone who has thrush, you will make it worse because steroids tend to affect the immune system. All right? So you may find that instead of her getting relief, she gets worse because the treatment she's getting is not for the thrush, it's for an allergic reaction, for example, for a skin problem. So fortunately, these conditions are easy to diagnose on examination. Thrush is easy to diagnose. You don't even have to do any further tests. But sometimes when these are skin problems, she may require a biopsy that may be sent to the laboratory that is going to give us the actual diagnosis so that the treatment will also be appropriate.
Now, speaking of the possibility of an allergic reaction, when one is allergic to a certain food,
yeah,
does that sometimes come in the form of the allergy then going to the vagina, for example?
If it's food, it's likely to be systemic. It's likely to affect the whole of the body. It's not going to confine it to the vagina.
But could that be included?
Food allergy, yes. Mm-hmm. But like what I'm saying is that because you ingest the food, it gets absorbed into the system. Mm. It's not likely to just go and itch in the genital area only. Okay. The itchiness might be generalized if it is food that is causing that.
All right. Hi, Dr. and Rebecca. I would like to ask on the issue that when someone has clamped ovaries, do they menstruate or does it encourage early menopause?
I think what she means there is clamped tubes, not ovaries. We don't often clamp the ovaries. We clamp the tubes. Right. If the issue is about the tubes, yes, you will continue to menstruate. However, the second part says, does that lead to early menopause? The answer is yes. Research has shown that when you work on the tubes, somehow you tend to affect the blood supply to the ovaries. So women who have been sterilized, when you take them as a group and you compare them with a group that has not sterilized, these women who have been sterilized tend to experience menopause a bit earlier compared to those who have not been sterilized. And the thinking is that there is some degree of interference with blood supply to the ovary when we work on the tubes.
All right, let's continue with the text messages. Hi, Rebecca and Doctor. My wife gave birth in February on the 16th rather, and my question is, how long does it take for her to get back to her period? And I ask that because we already had sexual intercourse. Could there be a chance for her to fall pregnant, and how high is it?
The question can be answered this way. The return to fertility and menstruation differs from one person to the other. There are a number of factors that will play a role there. One, whether she is breastfeeding, and if she is breastfeeding, is it exclusive breastfeeding? In other words, the baby is not given anything except the breast. If you do exclusive breastfeeding, you are likely to experience amenorrhea or absent menses a bit longer. And this is actually one form of contraception, what they call lactational amenorrheic method. So if you breastfeed exclusively and you don't menstruate for the first 6 months, you're not likely to fall pregnant as a result. The second factor could be whether she has started conception or not. I mean, this is April, so the 6 weeks has already expired if she delivered in February. So therefore, she could have gone back to see her doctor or to the clinic, at which time they'll discuss conception with her. And if they did give her the injection, this may delay return to menstruation as well. And 3, the other part of the question is whether she can conceive without having menstruated. The answer is yes. There is quite a number of women who, after giving birth, they always believe that when they are breastfeeding, they will not menstruate and they will not conceive. Some of them actually never get to see their periods. They will come back already with a baby that is playing, because since she gave birth, she has not menstruated, and all along she's been thinking, it's part of the delivery aspect, and the periods will come back, only to be told that no, you have actually fallen pregnant. So it can happen.
Okay, let's take a call and say good evening to Junior. Junior, hi. Well, thank you. How are you? The doctor's here.
Good evening, Junior. I'm very well. I'm happy that you're not anonymous and you're our first caller for the day.
Talk
Yes.
to us.
Yes. Mm-hmm. You had three babies by the age of 20. My goodness. Okay, you were busy. You're quite busy. Okay. Yes. And now you're married. He wants to pay the cows. Yes. Let's clarify one thing. I hear you saying that they took the decision to close you. This is not allowed. Perhaps you may not remember. They cannot take the decision on your behalf. At the age of 20, you are able to give them consent. And you did not need anybody's permission. So maybe you forgot. You actually allowed them to sterilize you. Because they would not do it against your will. Had you decided that you don't want to sterilize, they would not have done it. Right. Secondly, as to whether the tubes can be reversed or not, depends on the actual procedure that was done at the time. If they had actually tied and cut the tubes, It also depends on what portion of the tube has been cut. Secondly, it also depends on how long is the segment that was removed. So there are certain parts of the tube that if you remove, like the ones I do, when you ask me to sterilize you, I make sure that I remove the distal part of the tube. This is the part that contains what we call fimbria, the finger-like projections. The fimbria are the ones that actually pick up the tube, the egg. In the absence of the fimbria, you are not likely to fall pregnant once the fimbria are out. But if they had removed a segment in the middle of that tube, it is possible to go and reconnect that. The success will also depend on those factors that I have mentioned, but also the person who's doing the procedure. There are people who do these procedures on a regular basis, and therefore they tend to be more refined and they tend to be better compared to those who do these procedures occasionally. As they say in English, practice makes perfect. If you do something repeatedly, you tend to be good at it. So it will also depend on that. Now, at the age of 35, the possibility of falling pregnant is definitely there. But you may actually not even need to go and untie the tubes. You can consider to have in vitro fertilization, which I think would be your best bet, because it has much better results compared to surgery, which you are considering. Going to open or to go to rejoin your tubes. That procedure can be done, but the results are not impressive compared to someone who right away goes to have in vitro fertilization, which is a procedure whereby they will give you medication to stimulate the development of eggs. And when these eggs have developed, this can be seen on sonar, and they go and suck them out using a thin needle. These are collected in a test tube outside or in the laboratory. And they will take the sperm of your partner and mix the two. And then once fertilization has taken place outside, these embryos are then transferred. People who have this kind of procedure tend to succeed a lot more than those who go and have reversal of sterilization. The drawback, though, would be the cost. It is a bit costly. You and your man need to save a bit, but you would actually be better off to do the IVF than to go and have reversal. You may even come back with multiple pregnancy, twins or triplets, when you go for this procedure. Yeah.
All right, Junior. Yes. Mm.
Yeah. Firstly, I would urge you to go to the place where the sterilization was done to get information. They need to give you information of exactly what was done, because then this will help to know whether reversal is feasible or not. All right. You went to Mankweng Hospital. When was this? In 2006. At Mankweng. Okay. I left Mankweng Hospital in 2005, November. Because I worked there for quite a number of years. I wanted to know if I could be the one who sterilized you.
Oh.
Yes, it's very common. It's very common in Mankweng. I work there. Files get lost. Patients tend to have 3 files. One time they come back, the old file is not found. They open a new one. When they come back, the old file is found. The new one is not there. I used to struggle a bit with this kind of thing. I'm sorry to say it on air, but it's something that's common there.
Sure.
Yes. Yes. Well, the second part of your question is, where can you go? Any gynecologist, including at Mankweng Hospital, they do have gynecologists there. They can do this operation. And why I'm mentioning Mankweng, it's because if you went there, it will be a lot cheaper. You may pay almost nothing in a state facility. But if you went to private practice, it will cost you a lot of money. And it could range anything between 60 to 70,000, because then you have to pay doctors and you must pay the hospital as well. So the total bill may go as far as that.
Okay.
When you want reversal of sterilization in a private setup.
Okay. Junior, we have to take other calls. Thank you so much for giving us a call, yeah? Okay, thank you. Let's talk to Anonymous now. Anonymous, good evening. Welcome. Hi, Anonymous. We are well, thank you. Talk to us.
You mean bleeding for 2 months continuously? And what period? What contraception are you using? You're not on prevention. Okay, go on. It recurred again for another month. Yes. Okay. Yes. Okay. All right.
All right. Anonymous, will you listen on the radio for your answer, or do you feel you may need to ask the doctor a follow-up question? Okay, thank you very much. Doctor?
Right. She's 24 years. She's not on conception, and she has experienced abnormal uterine bleeding, prolonged with clots, according to a description. This could be a number of things, but the likely one would be abnormal ovarian function. It is not likely that this could be fibroids, because fibroids don't cause prolonged bleeding. People with fibroids bleed at the right time, but the bleeding is heavy. With ovarian abnormal functioning, there could be this kind of bleeding. And one potential cause of her problem could be polycystic ovarian syndrome, because it does usually this kind of thing. You tend to bleed erratically and prolonged and heavy, sometimes interspersed with amenorrhea, periods of amenorrhea. You may find that the listener is also struggling with body weight, and she could also be having increased body hair, what we call hirsutism. So with these things, and also skin problems such as acne, oily skin, things such as those, they all come together in women with polycystic ovarian syndrome. And I would urge her also, because she's gone to the clinic and according to her, they are not taking her serious. This time around, she needs to go and see a doctor.
Okay.
All right.
And just going back to that issue about the experience you've had, Doctor, and that of Junior about Mankweng Hospital, should it be that they feel like they want to come and clarify their side, if perhaps things have improved from the last time you were there, we're certainly
yes,
open to that.
They can. I mean, it was a huge problem. where patients' files would always be missing. Every time you see a patient, they come with a new file. The old file with information is not there. So it was a huge problem. Maybe things have improved. I left in 2005.
Certainly, yeah.
So things may be different now.
So should it be that they wish to come and just state their side? Be more
Yeah,
than welcome to
absolutely. And I'll be happy to hear that things are better.
do so. Sure. All right, it is an open line of female health with our resident gynecologist, Dr. Maluleke. This is how you can get in touch with us. You can give us a call. The number to dial is 015-151-1058, 015-151-1058, or you can send us a voice note to 060-771-5107, 060-771-5107, or you can send us a WhatsApp text to 079-295-1212, 079-295-1212. We'll continue with this conversation after the break.
Do you want to pay your bills, buy airtime, transfer or receive money with ease? You can do that and much more with Momo. It's like having cash in your hands. From next week, every Friday, join us right on this station as we bring you exciting information about all you can do with your Momo account. Open yours now. Dial *120*151# or download the Momo app. Deposit or withdraw at MTN shops, Pick n Pay, Boxer, and selected Spaza shops. It's go time. Everywhere you go, MTN.
Does your school, church, company, society need tailored clothing, uniforms, printed caps, t-shirts, and beanies in Polokwane? Well, Moti Branding is your go-to shop. Visit Moti Branding at Hostel Block H in Zone 6, Seshego, or call 015-223-0675. We supply all over Limpopo. Moti Branding, we do it in style.
L&P brand has moved to 20 Rusik Street, Polokwane, bringing you more advanced high-tech printing equipment in Limpopo. Services include printing of gazebos, flags, sportswear, printing of glass, wood, steel, and aluminium boards. Get canvas pictures, interior home and business decor, including promotional items. L&P brand also produces COVID-19 PPEs like 3-layer masks and face shields. Call us on 086-143-3677 or WhatsApp us on 067-951-3393. L&P brand, everything started as nothing.
Taku Confectionery makes customized cakes for all occasions, anniversaries, birthdays, baby and bridal shower, corporate, weddings, you name them. Not forgetting scones, muffins, cupcakes and biscuits. Enjoy from the first bite. Taku Confectionery also offers professional cake baking and decorating lessons. Taku Confectionery is based at number 5 Oleander Street, Flora Park. Call us on 082-486-6288 or visit our Facebook page at Taku Confectionery. Taku Confectionery, deliciously baked for you.
Conversations, Mondays to Thursdays, 6:30 to 8:30 p.m.
The time is 19 minutes past 8. This is Conversations on Energy FM 102.1 and Choice FM 101.1. I'm in conversation with our resident gynecologist, Dr. Maluleke. We are talking all things female health. It is an open line, and that means you're more than welcome to send through any gynecological question that you would like for the doctor to assist you with. This is how you can get in touch with us. You can give us a call. The number to dial is 015-151-1058, 015-151-1058. Or you can send us a WhatsApp text message instead to 079-295, or rather 295, that is 1212. Let me just say it right, 079-295-1212. Or you can send a voice note to 060-771-5107, 060-771-5107. Let's listen to a voice note.
Doctor, now I'm having a problem with my periods, like my menstruation cycle. I kind of like don't understand it, but to take you through my story is that ever since I started like having periods, my periods have been irregular. 6 months does pass without me having any periods, and it didn't start now. It started ever since I got my periods. 6 months passes without me getting my periods, or sometimes more than 6 months passes without me having periods. So I do not understand the reason behind that, and I don't have any pain or maybe any kind of, I cannot say I experience pain. I'm just normal. The difference is that I have irregular periods. That's the difference. And I think it's also taking a toll on me in terms of like conceiving. I find it difficult to conceive, and I don't know whether me being unable to conceive is because of this, my problem, my irregularity, or when it comes to periods. So please, doctor, can you explain for me?
Loud and clear. It would have been nicer if she had called, because there would be a number of questions we want to ask. But this is someone who has always had irregular periods from the time when she experienced her menarche to now. We would want to know how old she is. We would want to know if she has been on any contraception, and how long has she been trying to conceive and it's not happening, whether she has sought any form of treatment for this problem or not. These are some of the important things. But clearly, there is a hormonal problem here, clearly. And like we said previously, this could be anywhere along the hypothalamic, hypophyseal, ovarian axis. In other words, starting from the hypothalamus, which is in the brain, the hypophysis or the pituitary gland, also in the brain, and going down to the ovary. Along that axis, anything can go wrong. A number of other hormonal factors, such as the thyroid problem, it can also play a role. But she could also be having the condition that we have talked about earlier, polycystic ovarian syndrome. This can affect women throughout their reproductive life. Typically, in young girls, they present with absent menstruation or infrequent menses. These are the girls who would say, I'm surprised, doc, I menstruate and then I take 3 to 4, 5, 6 months without seeing my periods. Or I only menstruate when I am given the pill. This is typically how it will present. And women who are trying to have babies, they would come and say, I've been trying, I'm not falling pregnant. And when we investigate, we find that they are having polycystic ovarian syndrome. So I would urge her to go and be examined. Like I said, there are a number of things that will give this diagnosis away. Namely, we start with the period. The period can either be absent or it can be infrequent, and when it comes, it is heavy and painful. And 2, they tend to have excessive weight gain. 3, they have what we call subfertility. Subfertility means they struggle to fall pregnant, but they do actually fall pregnant. Typically, these are the women who will have a baby or struggle to have a baby. When they finally get one and they want to have the next one, it goes on and on and on without them falling pregnant. So you tend to have wide intervals between pregnancies. And sometimes it just happens out of the blue when they least expect it. They also tend to have acne. They also have oily skin, oily hair. Sometimes they tend to be a bit bold, with the hair receding, the hairline receding like that. They tend to have less hair on the head, but they will have a lot of hair on the other parts of the body. They have hair in their arms, on the chest. They may even have a bit of moustache on the chin there. These are some of the symptoms of polycystic ovarian syndrome. And when you examine them, you may pick up elevated blood pressure. You may find that they have elevated blood sugar. And on ultrasound, you will find enlarged ovaries with multiple black dots. These dots are the cysts. That's why they are called poly. There are many small cysts. And typically, they appear like a necklace around the ovary. And when you do blood tests, you will find what we call reversal of the ratio, where the follicle-stimulating hormone and the luteinizing hormone, under normal circumstances, the former is elevated and the latter is low. But with polycystic ovarian syndrome, the ratio is reversed.
Okay. Let's talk to Anonymous joining us on the line. Good evening, Anonymous.
Good evening.
Anonymous.
Good evening, sir.
Yes.
What is the question? What is the question?
The question, Anonymous?
So far, you have given us information. Right. Yes. She must be worried. That's not normal. Continuously for 2 weeks, it's not normal. Therefore, she must worry and she needs to take action. Worrying alone is not sufficient. Your girlfriend could be pregnant, maybe having a miscarriage, but she could also be having a much more serious condition such as an ectopic pregnancy. And the fact that she's got pain now makes it even more likely. So I would urge her to go and consult. One of the things that will be done will be a pregnancy test, and an ultrasound will be done. If there is a pregnancy state, it will pick this up. An ectopic pregnancy could be an emergency because it requires surgery to avoid or to prevent internal bleeding which may be fatal at times. So she must worry and she needs to go and consult ASAP. Right.
Thank you, Anonymous. All right. Good evening, Dr. and Rebecca. I have a problem. I don't conceive. I've been trying to fall pregnant since last year. And again, I have small genitals around my private part area. I've heard that this is an STI result. So I want to know if it's possible that I can get help and conceive from this stage. I used to have pains on my fallopian tubes, and these were strong pains that I sometimes could not walk back then. And then the doctor told me that these are just pain that will soon, which were showing that I'll soon have my period. What is happening, doctor?
Right. The issue of not falling pregnant, we must clarify it even further. She says, I am not falling pregnant. She should be saying, we are not falling pregnant, herself and the partner, because it's not often correct to just concentrate on the female. There is a lot of male infertility out there. And we have often said there is no one who's better than the other. 40% could be the female, 40% it could be the male, remaining 20% it could be both. So firstly, she must ensure that she has the support of her partner, and the two of them must go and be investigated. The fact that she's got period pains as well suggests that there could be an underlying problem in the pelvic area, such as fibroids, such as ovarian cysts, such as tubes that may be swollen. She's describing painful fallopian tubes. She could have had an infection, what we call a pelvic inflammatory disease. Pelvic inflammation, like we talked about it last week, it's an ascending infection into the reproductive. It starts from the vagina and into the uterus and spreads into the tubes. Then the tubes may become swollen. When they are swollen, they may contain pus. Sometimes this pus becomes sterile, and they may then develop what we call a hydrosalpinx, which is a result of infection. And unless these are treated, she will not be able to fall pregnant. She will always struggle with falling pregnant. And the treatment, if it is the tubes themselves, may require surgery to open the tubes up and drain whatever fluid that may be there. It may improve her chances of falling pregnant.
That is our time. Doctor, kindly share your contact details with us.
Yes, we are at 72A Compensati Street in Polokwane, 015-295-9407 or 295-9419.
Thank you very much, Doctor. We will hear from you next week, Thursday, God willing, right?
Absolutely. Thank you and good night.
Thank you, Doctor. Coming up next,
bye-bye.
Night Flight with Matumu Manaka. A big thank you goes to the great technical producer Emmanuel Pinda, and to you for always listening and interacting with us. I am Rebecca Pala. Enjoy the rest of your evening. Stay safe.
Conversations with Rebecca Pala.
Hey, Black people.
Hello.
Look at.
Okay. But I see some people are sharing your sentiments here about Mankweng Hospital.
Yeah, no. I worked there. You know Mankweng Hospital, ne?
The person has actually even deleted their message. But remember, it's the problem. Have you been to Mankweng Hospital?
I'm from there today for checkup.
All
Is
day,
your wife
every
still
day.
there?
We keep the hot sauce.